where the service provision is uninterrupted. How will it be uninterrupted? We need a strong logistic system to be put in place. And this has to do with procurement. And by the way, midwives may not be at the position of procuring, but we have in institutions individuals that have been tasked rather with the key role of procuring. So once those commodities have been procured, and this is ensured by midwives that have been put in leadership position, we need storage facilities that will be used as distribution points to all our facilities. Now, besides that, family planning cannot be effective without adherence to infection prevention. Remember, some of the methods that we are using are methods that are invasive, are methods that would definitely require going under the skin or entering the body structures. So, because of that, we need to adhere to infection prevention protocols. This could be general infection prevention protocols that could be adhered to across our countries, but of course, similarities would exist. In our context, we are using chlorine, which is sodium hypochlorite. So this becomes one of the most used solutions for decontamination and doing all these infection prevention protocols. Apart from that, also the issue of having clean, consistent, safe running water and adequate supply of soap. This will ensure that when these services are being provided, midwives have washed their hands as it is stipulated that before we do any procedure, hands should be washed. And apart from that, it's also very important that we manage the disposal of the waste that we are generating from our processes. So all these speaks to the issue of infection prevention. Record keeping is one of the key elements of our services. And if there is a department or service areas where a lot of data is generated, it is pertaining to midwifery. You will agree with me, even when you go into labor ward, there's a lot that is being recorded. You go to maternal child health facilities, a lot more data is being generated. So record keeping is key. And I know that there is a lot of transformation that is being done. We are seeing transitioning from physical records to electronic records. And this is just to enhance how we are keeping our records. And this I know would include the client's cards with personal particulars, demographic data embedded in it, and also it clearly stipulates what services could have been offered to a client at a particular time. Referral systems and so on should also be recorded. Now, for a service to be efficient, it cannot be devoid of monitoring and evaluation. Now, monitoring and evaluation is key. And by the way, when we speak to the issues of evaluation, we have two types. We have summative, and then we also have formative evaluation. Formative evaluation is ongoing. Even as we are providing these services, we need to ensure that our services are meeting the required standards. Now, for them to meet the required standards, we need to evaluate on a day-to-day basis. And besides doing this on a day-to-day basis, we also can do summative evaluation. Summative evaluation is done at the end of this service provision. It could be that you are doing summative evaluation quarterly or annually, depending on the key performance indicators that you are following. So, monitoring and evaluation is all about setting up a system that will ensure that our family planning services are efficient. And by the way, if there are any gaps, technical support and supervision can come through. So, this is also so critical to, I think, just remember. Now, besides this, we would also want to discuss the benefits of family planning to different levels of care. The benefits of family planning to different levels of our care. We will begin with the key um, a person who is the mother or the woman herself. So, what are the benefits of family planning to this woman? Number one, it will protect this woman from unwanted and planned pregnancies, and secondly, it will also help provide better health and protection from certain diseases like certain cancers. Now, speaking to this element, you will agree with me that at times in our facilities, our cancer facilities, we could have noted the use of estrogen. And I know mainly they will use notisterat, that injectable for 2 months. Yes, I don't know how many times I'll apologize, but we can still continue. So I was saying that speaking to point number two, which speaks to protection from certain diseases like cancers, I was just giving an example that maybe in your practice, you could have come across the use of estrogen to actually treat cancers, for example, cervical cancer. And I was giving one of the family planning methods, notisterat, that thick contraceptive which a woman would receive every after 2 months, and I know that after two jabs or two reviews, this can be extended to 3 months. So it would help, okay, prevent such cancer. Then thirdly, it also helps women to have freedom of decision making. And this is so critical because at times she may prevent this pregnancy from happening now if she has planned that this pregnancy can happen maybe after 2 years. So, with what we have discussed above, the 3 points, this eventually will improve the overall quality of life of this mother. Now, to the father, it provides protection from STIs, and this also includes HIV. Why? Because we have certain family planning methods that are basically barriers. Then, besides this, we are seeing, because of the spacing that is coming in, we are seeing one, economically being strengthened. Besides that, it also gives an opportunity for one's emotional issues to be stabilized. So there is also improved quality of life. Why? Because the resources are evenly distributed, and this, of course, is across each member of the family. That's if the family is minimized. Now, to the children, obviously, there will be more food and other resources will be available for these kids. There are better opportunities for education. We know now that, of course, in some countries, our countries across, maybe education is free, but despite it being free, we have seen parents reaching out to ensure that children get the best from the private institution. And these are not free anyway. So there are also better opportunities for emotional support from parents. If you have a lot of children, before attention is even exhausted on this one, another one comes, and at the end of the day, children sometimes would feel they are no longer loved. Meanwhile, they are, but it's just that there are a lot of children whose would definitely demand attention. So, to overall, to the family, it improves the family well-being, freedom to decide when to have children, less emotional and financial strain, increased education opportunities. It's just a repetition of what we have covered. To the youths, adolescents, there is protection from early and unwanted pregnancies. Just recently, we were reviewing some data pertaining to what is currently prevailing in Zambia. And we, I think, noticed that we have a lot of unwanted pregnancies in areas where there are a lot of traditional ceremonies. Okay, because such areas would attract a lot of inflow of people from other towns. And as this is happening, there is a lot of activities that are happening, and we end up having a lot of unwanted pregnancies. Then, apart from this, for the youths and adolescents, we know some of the methods are barriers against STIs and HIV. So definitely they will be protected. There is also prevention from unsafe abortions. This is something that I think brings out a lot of issues, but at the end of it all, we have seen in some facilities, we have seen NGOs, non-government organizations coming up with initiatives of distributing contraceptives to school-going children, which I think, for example, in our setup has really been met with a lot of backlash because others have termed it to be moral, But at the end of it all, there are things that would you think we are protecting our children from, and ideally themselves, they are deep into practicing them, like sexual activities. So, yes, it can be used to prevent these unsafe abortions, but at the end of it all, we are seeing this being done. You would say no. And by the way, what we have noticed that children as early as 13 years old, they have already started practicing sex. And because of this, it becomes highly debatable. Should we provide contraceptives to them? Should we just watch and look at them? To the community, family planning actually helps reduce the strain on the few resources that are available. Okay. Apart from that, we have also reduced the strain on community services, healthcare services, schools, social amenities, and so on. There is greater participation, by the way, by individuals in community affairs. Why? Because we have a regulated population. The nation at large, of course, we have noticed even these countries that are very developed. Some they have extremely low population, but others they have higher populations and so on. But ultimately, what we could have seen as benefits as the individual, the family, um, the family, the community level is being replicated at the national level. So I think this will be noticed by fewer diseases. Health standards will definitely improve, reduced mortality. Okay, so now we are coming to should be the last component of our presentations, and that is the methods of family planning. I will cruise through because these are methods that we are conversant with. Maybe before we continue, do we have any question? Any questions, or is it clear? We proceed. Any questions?
On my side, everything is good, is clear.
Okay, Julia, any questions?
There is no question. Thank you.
All right. I think others have dropped out. We can continue. So, methods that are so common, of course, we will start with the oral contraceptives, the pill, and we know that these are subdivided into two. We have POPs and we have COCs. POPs, the mini pill, COCs, these are combined. So progesterone only pills or combined oral contraceptives, both they are using synthetic hormones. And synthetic hormones means these are hormones that are created or developed. So they are using these hormones. When you look at the pack of these contraceptives, the boxes would find it's written progestin, okay, and estrogen. So these are synthetic and they mimic the same hormones which our bodies would definitely produce. Now, the pregnancy would be inhibited or prevented. By the way, it's all about, I think when we are doing applied anatomy with Madam Tembo, one thing that you could have learned, it's the menstrual cycle, I presume so. So the menstrual cycle is the foundation of what we are discussing. If we understood it, then definitely this would be more understandable. So all in all, there is just inhibition of ovulation. Okay? Inhibition of ovulation, and at the end of the day, we will have no fertilization that will definitely occur. Fertilization can occur, but there will be no implantation that may even come in. So the the contraceptives themselves will change the uterine lining, the endometrium, thicken the cervical mucus, thereby inhibiting the sperm from penetrating. So this is a reversible method, the pill. Okay, and one thing that is very important to take note: effectiveness. It can go to 100% if it is taken rightly, and apart from that, if it is stored in a proper manner. But one thing that I also want to maybe mention when we are discussing these oral contraceptives, a person or an individual, this woman should be taking them at the same time every day. If she has chosen 20 hours, it should be 20 hours daily. If it is 19, it's 19. Okay? 8 p.m., 7 p.m., 5 p.m. So timing becomes so important. And why is this critical? Because we are looking at the half life of these contraceptives, usually 24 hours. So if you took today 9 hours, tomorrow you take it at 12. You have already disturbed the concentration of the hormones in the body, and one will definitely fall pregnant. And if today someone is taking this pill, immediately they have swallowed, they have taken a pill, they vomit. If they do not repeat the second pill, it becomes a problem. And if they forgot to take a pill today, they remember the following day. What would happen for the following 7 days is that they need to use protection, and these are condoms. Okay, so that that misty 24-hour period could be sustained by the subsequent days that these contraceptives will be taken. So the advantages does not interfere with coitus, quick return of fertility. If you stop taking pills today, even within few days, fertility would have returned. It regulates the menstrual cycle, as both estrogen and progesterone that regulate the menstrual cycle are present in the circulation. Disadvantages: at times it may reduce menstrual flow, and we have noticed in some where they will come with cessation of menstruation. Others it's an advantage, others it's an issue. So it reduces the risk of ovarian cysts. Okay. Apart from that one, it also reduce the risk of endometriosis, ovarian, and the endometrial cancer is prevented. Earlier on, I've spoken to the issue of estrogen being so key in preventing the development of cancers. So these are some of the misconceptions, myths which communities hold on to say if you're taking these contraceptives, you develop cancer. We need to demystify that. So must be taken every day. That's another disadvantage. It's daily. Then the other disadvantage, if you're taking COCs, combined oral contraceptives, meaning they have two hormones. Lactation is suppressed, okay, as the combined effect of estrogen and progesterone will inhibit prolactin, a milk-producing hormone. Then, unfortunately, at times the effectiveness of the oral contraceptives is also reduced if you are taking alongside drugs like rifampicin, griselfavin, or these other epileptic drugs, okay, like phenytoin and carbamazepine. So, in terms of that, we may not just advise this woman to be taking these oral contraceptives. The other disadvantage is possible mood swings or depression. Okay, and it does not prevent sexually transmitted infections, HIV/AIDS, or hepatitis B. So when we come to the other grouping of these contraceptives, which are the injectables, these ones also contain synthetic hormones and mainly the progesterone, which inhibits ovulation or rather also thickens the cervical mucus. So, what we are seeing under injectables are the most common ones. Okay. For example, Depo-Provera, which is very common. Noristerat. Depo-Provera is for 3 months. Noristerat is for 2 months, an interval of every 2 months. But when you read the guidelines, if one has been so consistent in coming for review for Noristerat, the third dose you can change and go to 3 months. It is still safe. Effectiveness 99%. The advantages, of course, obviously similar with the contraceptive, do not interfere with coitus, can be used during lactation. And I think that's one thing that is so important to take note. A mother who is lactating can use it. Okay, it won't contain progesterone. After 6 weeks postpartum, it could be beta. That's if this woman is uh, anyway. There are human rights. There are these issues of respect for maternity care. So if she decides to use after 6 months, well and good, you can administer and so on. Then apart from that, the other advantage, of course, we have emphasized the reason why we want this woman to be injected is because it does not interfere with prolactin. Then the other advantage is that it ensures periodic contact. It's not daily. This woman will just be coming every after 2 or 3 months, and it may stop menses or make them very light. To some women, this becomes a huge advantage. Excellent alternative for women 35 and older. Okay, why? Because it will reduce the risk of ovarian and the endometrial cancer. That's why earlier on I was saying these injectables can be used as an alternative treatment for these cancers because they will not promote the hyperplasia of these cells. Cells could have differentiated, they become cancerous, so the recession would come in if we have the presence, consistent presence of progesterone. Disadvantages, sometimes these men's bleeding can be regular or unpredictable and it may lead to spotting, okay, possible weight gain, and of which this is a major thing. You would see a lot of women really gaining a lot of weight, okay, and when I'm saying weight gain, it's marked weight gain, not just weight gain for just for few kilograms, okay. Then apart from this, some may even lose appetite, variations in appetite. It may delay chances of getting pregnant after the doses are stopped. That's the thing. We have seen some who could have gone even up to 2 years, okay, because of the sustained concentrations. menses, fertility is gone. Unfortunately, some could have even led to divorces. And that's why when we speak to those pills that are highly abused, the morning after pills, they have high doses of these hormones. And if you follow the guidelines, in a year, someone should just be exposed to morning after pills, I think 3 times. But you notice that someone could have used 6 times of the morning after pills, and at the end of the day, the body goes into so much confusion, and this can even go now into infertility, of which can be reversed, but after a marked period of time. Does not protect against sexually transmitted infections or HIV. Okay. And the other disadvantage is that this woman will not receive this injectable from Norway. They need to move to the facility that is providing these contraceptives. Then, besides this, we have another grouping of contraceptives which are mechanical or barrier methods. Very common, the intrauterine contraceptive device, IUCD. And I know that the intrauterine contraceptive device right now comes in so many forms. There are some which are even hormonal, they contain hormones, but the majority that we have seen and which could have been in existence for a longer time, it's the famous copper T, which, of course, for it has no hormones, but it has a coil of copper around the middle pole. Okay, the mechanism is that this copper will be discharging, for a lack of a better term, electrons that will interfere with this sperm that could have been ejaculated. But at the same time, what becomes so important is for us to understand that usually the intrauterine contraceptive device will go and fit in the uterus, giving no room for a site of implantation. But if they are not put nicely, one can conceive, and this I think has been reported several times. And because of this, the most obvious time when one should insert this uh, IUCD, it is during the very moment when this woman has delivered. If it can be put before she goes back home, it is even better. Why? Because the cervical os is already open and you will not really struggle to have it inserted. So IUCD, very important. Effective 99%. Advantages: immediately it becomes effective, easily inserted, has no side effects because there's no hormones usually, but today we have those hormonal ones, and it can be used for a longer period of time, 10 years maximum. Okay, so those women that we were profiling yesterday, if someone wants to delay pregnancy for this long period of time, why not try this? So it is for a long period of time, 10 years. Reduce risk of tubal pregnancy. Okay, then does not interfere with lactation in any way. Can return to fertility immediately with no infections, if no infection could have occurred. Disadvantages, okay, must be inserted, removed in a clinic by a trained, specialized provider. May at times come with cramping or pain at the time of insertion. We have seen women who have experienced increased bleeding or cramping during periods. Spotting can be noticed, cannot be used by women with multiple sex partners, as this will just promote the the an increased exposure to STIs, and apart from that, it can even lead to pelvic inflammatory diseases. So the other one is condoms, which could be male and female. Yeah, this is commonly used and is one of the methods that is sold proudly so across even areas which are non-medical, the shops, the malls, and so on. And strategically, they are placed in areas where one could easily spot them. So we have male and female condoms. Advantages, they easy to get and relatively inexpensive. At times, they can be placed in toilets using condom dispensers. Can be discontinued at any time. Provides protection from STIs and HIV. Cervical cancer, because we know that the carriers of this is coming from men. So if this man is able to use this condom, definitely he will not promote the formation of these cancers. Reliable method for people who cannot use hormonal birth control methods, but real arguments come in, especially for those who could have been married, they're using condoms. It provides dual protection for a client who is just commenced on COCs. Why? Because when one has commenced on COCs for the next 7 days, if they want to have coitus or sex, they need to use these barriers for the next 7 days. So responsibility is for both partners, can be purchased without a prescription, and has no effect on breastfeeding. When it comes to infertility, no effect at all, and maybe used immediately after birth. Disadvantages, it will require a man's cooperation. If it's a female condom, it would require the cooperation of the other person. Some irritation, of course, have been noted, especially in men and women who are sensitive to latex, the material used for formation of condoms. Then it reduces sexual feelings, and these have been some discussion that the female condom is even better than the male condom. Then spillage or leakage of sperm, if possible, if it is placed inappropriately, can be one thing that could be noted. The female condom, so similar to what we have discussed on the male condom, but when it comes to advantages, um, we can note that it is preferable, more preferable than the male condom, because number one, this condom can be inserted or worn 8 hours before sexual intercourse. It can be used with spermicides to increase STI's protection, and apart from that, it's made from polyurethane plastic. The male condom is made from latex, and this special plastic, which it is made from, it conducts a lot of body heat, and at times those who could have used it, there are reports of it having almost a near condomless experience. So yeah, I think that's what we were just trying to say: increased sensitivity. Disadvantages: difficult to insert or keep in place. Remember, we are saying 8 hours before. Cannot be combined with male condoms. Could be noisy if not correctly put on, may irritate the vagina or the penis. More expensive than the male condom, but at times they are given for free. And after the manage ejaculates, the open end must be twisted gently. And if this is not done or incorrectly done, someone can even become pregnant at the end of the sexual intercourse. So the other contraceptives which we can fall back on are implants. And I know that I think we were discussing just, is it yesterday or the other day, when the issues of implanon came in. Jadel, it is almost falling out of uh, um, practice because some women definitely would need a shorter period of time. So they would rather go for a method that is for a shorter period of time. So implants basically are just flexible plastics containing still the synthetic hormones. Important to remember. We have 1 minute 20. We can just borrow 5 minutes more. Okay, so um, with this being said, the actions is similar. Okay, so similar to what we have already discussed. It's all about the ovulation. The menstrual cycle is a target. It's a huge target. Very effective. Implants are very effective. Implanon, Jadel, yeah, very effective. Jadel, some time back, they were using more. I think there were three uh, uh, rods which have been reduced. So one and two flexible tubes respectively can be put. 99% effective. Advantages, yes, it can go up to 5 years. Highly effective. And it should be effective just after 24 hours. It will protect against anemia. Why? Because at times it has been recorded that it reduces menstrual flow. Can be removed anytime, but at the end we have seen this to be a wastage of resources. Women would come, a good number, they get this implant after a few months, they come back, they want it to be removed. Does not interfere with sex in any way, reduces risk of ovarian or endometrial cancers as reasons given above. One other thing that has also been recorded is that at times it may worsen the bleeding. Okay, of course, it will not offer protection against STIs. Insertion removal requires a trained health provider. We have had cases where a woman's hand has been amputated because of the infection that are introduced. Very expensive. If you have seen the pack itself, it will come with a load, it will come with a lot of things. At the end of the day, it becomes expensive. Requires minor surgery for insertion and the removal of the capsules, which is done under usual aseptic technique. So all this is a cost. Effectiveness is lowered by most anticonvulsant medications, epileptic drugs, may cause discomfort during insertion and removal. Then when we come to the other end, we have permanent methods, surgical methods, BTL, bilateral.
Sorry,
Yes, please.
I have question about those implanon.
Yes,
You were saying that when they are inserted, the
yes,
woman can be, it can work, it can start to work after 24 hours.
yes.
What I have challenges there
Mhm,
because in our protocol, they when we are inserting this implanon, they
mhm.
told us to give the mother a condom because it will be working after 7 days.
Okay, I
What
think. Oh yes, we can continue. Continue, please.
I want to know what do you think about that interaction?
So so for me that becomes an extra precaution, which is okay, which is very fine, which is still very fine, and I know the reason why that comes in is because probably the thinking or the rationale, it could be once this implant has been inserted for that hormone to start, for those rods to start discharging the synthetic hormones into the system, it may take time. But 7 days, I know is actually too much. It's I think way back, but since it's a protocol that the country has adopted, we cannot just do otherwise, and we just have to follow what it is. What I have noticed, even from practice, the contraceptives, the oral contraceptives, are the ones that are subjected to 7 days. But for these implants, 7 days is way too much. But of course, if that's what has been adopted, we just have to adhere to that. I think that's my comment. Maybe others could want to comment on the same.
Okay, thank you very much.
You are welcome. Any comment from Julia, Annette? What's your practice?
No comment from
Yeah,
Julia. Thank you.
Yeah, from Annette, it's the same because this is the country protocol, which says that we should at least give a protective method in addition for 7 days. Thank you.
Oh, thank you so much for that submission. Thank you. We are almost ending. Do not be dismayed. We'll be ending very, very shortly. Okay, so where is this slide of mine? Should be here. Okay, so looking at what we have covered, when we go into the permanent methods, these become surgical, and the first one we're looking at, it was the BTL, the bilateral tubal ligation. Now, one thing about BTL is that both parties should consent. We have noticed, and it has been noticed, that at times this woman can be subjected to BTL, then this man U-turns and goes on having children from somewhere else. So the reason why the man should also be available to consent is because this can be regularized if such a procedure is followed. And this woman is at liberty to actually sue this man in the court of law. So BTL, the surgical intervention, mechanically you are blocking the fallopian tubes to prevent the sperm and the ovum from fertilization. Effective 90%. Few instances when these tubes have been ligated, we have seen some operations that have not been effective. Seeing this woman again conceiving, advantages continue in that it becomes reliable, effective method of contraception. It's a permanent method. Okay, no side effects apart from the few pains that this woman will be having. No interruption sexually, does not interfere with breastfeeding. Disadvantages, permanent method, it may be unsuitable for those who are just delaying having children. Difficult and expensive to reverse this surgical procedure. Of course, with the advancement in technology, there could be reconstruction of the tubes, which I think would definitely be just wastage of resources. Requires skilled surgeon to perform the procedure. It's a procedure that takes few minutes. Possible ectopic pregnancy is envisioned if the method fails. So there is no protection from STIs or HIV. Vasectomy is a form of BTL but in a man. So it's a procedure where cuts are made into the vas deferens, blocking them so that no sperms are contained in the ejaculate. And that's why even after this has been done, it's important that this man ejaculates about 20 times or more to clear off all the sperm from the ejaculate. Very effective, similarly, like the BTL. Then advantages, yes, very safe surgical procedure, highly effective. It removes the responsibility of contraception from the woman. But what I've noticed, if a woman goes for BTL, some couples are also encouraged that this man should also go for vasectomy. No significant long-term side effects. Equally does not interrupt sexual relations and highly acceptable method. Disadvantages: it's a protection only for um, uh, a man. Females still protection for the man only, for the male only. Females at risk for pregnancy. Okay, this is a couple. If this woman goes outside there, which doesn't really make very rational sense, but of course, if this woman thinks I cannot fall pregnant because this man is undergone this operation, I can sleep around anyway. Those who are not maybe exposed to such could do that. So usually irreversible, not immediately effective. Why? Because of those 20 ejaculates. It may need skilled personnel, no protection against STIs, HIV, expensive. When we come to the last part of our presentation, which speaks to natural methods of contraception, these ones we are seeing the fertility awareness method, the farms, and usually this woman would notice the changes in the cervical mucus, it thins, it thickens, and so on. When we come to another method, the basal body temperature, this again is a daily monitoring of body temperature. Okay, and it is based on the fact that a woman's temperature drops 12 to 24 hours before an egg is released from her ovary and then increases again once the eggs have been released. Unfortunately, there are variations, there are a lot of factors that may affect someone's temperature, and it may require that this temperature readings are taken every morning and recorded, charted. So it becomes a bit cumbersome and at times may also not just be very reliable. When we come to mucus inspection as a natural method again, this one is depending on the thinness, the thickness of mucus itself, um, and of course, all these methods are natural. When we speak of the withdrawal method, this is where a man withdraws his penis from a woman's vagina before he ejaculates. Very difficult. Of course, that's why even efficacy is low. It's 80. No cost involved, requires no devices, no chemicals. But its advantages, even the pre semen that comes out may contain the sperms. So even if someone withdraws, by the time they want to ejaculate, probably this woman is already pregnant. Lactation amenorrhea, very common and very effective as long as this woman is exclusively breastfeeding and only lasts for 6 months postpartumly. And I think we could have spoken of this, the morning after pills. I think that's the end. I don't want to go so much extra beyond time. Any questions? Any questions or comments? Any question from Julia or contribution?
No question.
Thank you. Agnes, do you have anything to add?
No question, nothing to add.
Thank you. Annette?
Even me, no, there is no question. The presentation was very clear and good. Thank you very
Okay,
much.
thank you. We'll end here. This was my last session, but there's one more presentation we need to have just on the medications, the magnesium sulfate, and all these drugs. We'll ask Julius if he can slot one more session next week. For now, I sincerely thank you and apologies once more for a lot of interruption during today's session. It's a warm and great night to all of us.
Thank you too for your interesting session, and we are very, very appreciative of that.
Thank you, Agnes.
Thank you very much. The presentation, I can repeat, it was very good and interactive. At least it has helped us to understand some of the things that were not matching.
Okay.
Unless there is something that I have remembered.
Uh,
For the permanent method for tubal ligation and vasectomy, you
yes,
said that the couples should sign, both of them should sign,
that's
but
the
in our
idea. Yes.
country it's no in our country it's no longer like that.
Mm-hmm.
If a mother or the client signs, that's
Mm.
enough. We can do the BTL,
I see.
not necessarily that it should be accompanied by the husband. So
Okay.
it's just a contribution.
Oh, great. No, thank you
Thank you.
so much
Mm.
for that contribution. I think it can definitely vary across countries, but for us, ideally they would want this couple to appear. But in few instances that could be done. But couples would appear for what I had mentioned. Someone forces the woman to do BTO. Meanwhile, themselves, they have other plans. So at the end of it all, it just becomes an issue that confuses everything. So thank you for sharing that.
Thank you.
Thank you very much, Doc, for your classes. You never missed classes. You have been on classes and very punctual, and your lessons were elaborate enough for us to understand everything that was taught. So we are also thankful so that we have shared the materials in IECO. Thank you
Thank you
very
so.
much.
Yeah, thank you. You're welcome. Definitely. I was trying to put these slides on the platform. That doesn't work. But I think I will send to Julia so that you circulate to colleagues.
They are there. They are there. I have seen all the presentations you have
Really?
shared.
Ah,
Yes,
great.
I have even downloaded
Ah,
yesterday.
thank you. I thought I did not know how now to Julius could have been so furious with me. So I think thank you and a good night.
Thank you and
Good
bye.
night. Bye bye.